Caroline Barmer, Chief Executive Officer of Oakland Care. I think it's important on multiple levels. I suppose thinking about the strategic nature of the business, it's important for the investors. They ultimately are wanting to invest more and more into sustainable businesses. So by being sustainable, it enables us to attract better support and therefore better ability to grow as a company. I think it's, as you said, it's important to care seekers, so it helps us to maximise the amount of residents that might want to come and choose to live with us. It's important for our team members. We ultimately attract a wide variety of ages and people from different ethnic backgrounds. And certainly in the younger workforce, we see a very vocal desire from them to want to work for companies that are seen and able to evidence what they're doing around sustainability. So it helps us to be able to attract more people to come and work with us. And it also helps us to retain people, because we don't just have a day job where people are coming in and doing very focused tasks. Their day job might include going out for a day and doing litter pick with residents and other colleagues, or a day of fun going out doing tree planting, or lots of other things. So it gives people variety in their job role. It allows people to be involved. We have at least 2 team members in every home, plus people in head office departments that are part of our greener committee. So they're involved in the decision making. They're involved in generating ideas, sharing ideas with other homes, and it gives people real variety and inspiration in their job. I think it's evolving very quickly. At the moment, I get a sense that there's a lot of talk about sustainability in the care sector, but there isn't so much action following through with it. And I think that's due to a number of reasons. Firstly, a lot of providers are still finding their feet after the COVID pandemic. Also, you've got a lot of other operational challenges because of Brexit, whether it's supply chain costs, interest rates are high, staffing costs are high. So there are a lot of operational challenges facing providers that may well have an absolute committed interest and desire to become more sustainable, but actually it probably falls in the bottom third of their priorities on a day-to-day basis, and they may not have the liquidity of funds in order to feel like they can make a difference. But I think everybody has to start somewhere, and at Oakland Care we've spent, say, over 3 years getting to the point of where we are now. And there are lots of things that care providers can do to start that journey that don't come at a huge cost. And you do need to use the people and the resources that you've got in the care homes to come on the journey and do the work with you, rather than just feeling it's all about spending lots of money on technology. There is a balance between what you can do to make an impact on the environment and help to reduce your carbon footprint that doesn't always cost huge volumes of money. I think certainly in terms of care seekers, absolutely, and we already see that coming through. We have quite a lot of information on our website around what we do as a company for sustainability, and undoubtedly when potential care seekers come and have a show round, it's quite obvious frequently that they've already read that information, and they seek to validate the things that we've said on the website when they're doing their show round, looking at what we're doing around waste management, for example. And they'll openly mention that to the people that are assisting them with the show round and talk to them more about what we're doing on sustainability. So I'm extremely confident that it's becoming a more and more important factor for people when they're choosing care for a loved one. So in terms of technology for improving sustainability, there's a couple of examples, particularly around waste management, that I could highlight. One was the introduction of vacuumatic technology in all of our homes, which basically condenses and minimises the amount of contaminated clinical waste and hazardous waste that needs to be treated and then recycled. So that means that not only are our workplaces a better environment because we don't have offensive smells by vacuumising waste, but you also mean that you have less waste in your outside bin, and it also means that you have less frequent lorries coming to do those collections, which is obviously better in terms of road mileage, and less waste that's actually going through the processing system. Similarly linked to that, we'll be using Bluetooth technology in continence products that will also reduce the number of products that get discarded early. So products will only be changed for residents when they actually need to be changed, which means residents are going to get more person-centred care because they'll be receiving the care when they need it, and less waste will be going through the recycling process again. So we'll be cutting our waste in total by 50% based on where we were 2 years ago, like for like. So I think in terms of return on investment, it takes time. So we are in a phase where we are investing in sustainability. We don't yet see a return on investment, and some of that's because as we've invested in certain technologies, other things have countered, such as rising energy costs. But absolutely we expect to see a return on investment. We know that the whole value of our buildings will be higher because of the sustainable interventions that we have put into place. And so in the longer term, the value of the assets within care homes will go up because of the sustainable technology that they've put into place. And also, you know, even if you think about staffing, if we're able to have a well-hired and motivated workforce where we're not using agency staff, that is going to impact on our bottom line. And so there are things that you might not directly correlate to sustainability, but it is a byproduct of what you're doing in the sustainability agenda that's going to help you attract and retain more staff. Therefore, your residents are getting better care, you're going to have better regulatory outcomes, you're going to have better resident wellbeing, so they'll hopefully live with you longer, they'll give good stories to their friends and neighbours about the care home, so that will help us to attract more residents, and it's a spreading circle, I would say. There are quick wins, and the quick wins is something I've really focused on when I've been supporting other providers and in them starting their journey. The biggest quick win I would suggest to any provider is that the power is in your workforce, and getting your team members to really drive the ESG agenda is really important. It's not something that I dictate at CEO level and everybody just follows and does whatever I set out in the strategy. It's very much the other way around. So that will definitely be a very quick enabler for other providers to make progress. In terms of what's going to happen to help the sector get to net zero, I do think that there's a lot that the government could assist social care with. You know, we could have, for example, premium tariffs for greener placements where care providers are able to evidence that they are taking certain steps towards net zero. I think there could also be subsidisations on the implementation of certain types of technology where we've got an evidence base that use of that technology is going to have a direct correlated impact on reducing care providers' carbon footprint. My first practical advice would be to engage in a baseline audit, something like Green Mark Level 1, which is quite easy to do, but it really helps you to get an oversight of where you are now and what the quick wins are and things that you can do to start your journey. My second piece of advice would be to try to separate out what you can do as a quick win that's low cost investment if you haven't got a lot of liquidity to invest, versus what is going to cost a lot of money and might need to be coming later down the line. And my third and most strongest piece of advice would be to engage your workforce. Very, very important that this isn't a top-down approach in a care home company. It needs to be coming from the team members. They are your greatest asset, and they certainly will help you along the journey. And I always say that sustainability for us isn't just a project, it's a social movement, and it's something that we're all engaged in, and it's part of our company values, and we expect everybody to have the same values in helping us to reduce our carbon footprint.
Hi, I'm Jonathan Burridge, CEO and one of the founders of Utopi.
Yeah, I'm Falk Blyer. I'm CTO and co-founder at Utopi.
So I think the reality here is that whether we're feeling the pain today as an operator or it's something that maybe is on the medium-term horizon, there is no doubt that ESG reporting metrics are going to become compulsory in all types of assets, because ultimately for the world to move towards net zero carbon, the first thing we need to be able to do is measure, because you can't manage what you don't measure. And I think from an operational perspective today, that might be secondary to all of the operational tasks and responsibilities that you hold, but actually this will become a prerequisite for all building types over time. So I think being able to get ahead of that is really important. So that problem may have already arrived at your door as an operator, but if it hasn't, it's coming. And I think from our perspective, having that in a platform that's automated, it has other ways that it drives value into the building, into the care setting. I think that additional value will obviously help with the engagement around the product itself and the technologies that we deploy. But naturally, the spin-off benefit is that kind of automated data collection to meet the kind of compliance requirements is just there, and it's a feature of the product. So it might not feel important today, but it will be definitely an important feature in every building actually across the planet. So primarily visibility, right? So with data, granular data being collected in real or near to real time, across all of the spaces in the building, you have transparency. You can see what's happening. So, as an operator, having that level of transparency, whether it's for one or multiple buildings, in a single platform, that can be deployed anywhere in the world, that is really, really powerful way of getting transparency and that kind of actionable insight into your day-to-day activities. We've got clients that will log in centrally into building platforms, where the platform itself is in a building in Spain and they're based in London, and they'll identify centrally, we've got an issue, we need to make an intervention. And, they can help then with the operational teams on site, educate, inform and make those changes. So, having a single place to be able to get that level of transparency is so powerful. And when you think about that across multiple locations, whether that is in the UK or abroad, that becomes a much easier way to have that visibility of what's going on. So I think that's a key component for the operational teams.
What we effectively do is we take a building that operational staff work in and provide an X-ray vision on the building in so many different ways, where at a glance you'll be able to look at a heat map, if you like, of a particular facility, and you can see what the temperature is across your whole estate in one go. And that can provide reassurance, and it can also provide indications as to where issues arise. What we also do is we provide alerts, and those alerts can be via email or via webhook into an existing workflow, a system that an operator may have, so that basically alarms of a certain kind, let's say, that there's a space that is underheated or overheated, or the air quality is bad, or so, that those kinds of alerts can flow directly to the on-site staff, so that they can deal with those kinds of things. So the time frame from issue recognition to resolution can be dramatically reduced. As far as Utopi's platform and services are concerned, one of the key things is that we want to measure and report on and analyze utility consumption in its various forms. And from that point of view, we have completed our portfolio of different data ingestion methods, so that we can actually bring that full data set in. And what's important is that we gather that data on a granular and a real-time basis, and then make that data available to our customers. And we provide analytics and comparative data as well in that respect.
So the great news is our product does have a really clear return on investment. So with the energy control methods that we've deployed, things like controlling thermostatic radiator valves and various different alerting capabilities that we have in our platform, there is a direct cost saving on energy. And naturally, in a care setting, we need to keep these spaces warm. And in the winter, the challenge is not overheating to the extent that it either becomes uncomfortable or there is a significant amount of waste. So with our products, you can be confident that those thresholds have been set and managed by the platform and by the technology, which will also underpin a very clear savings profile throughout the period. And we've modelled this for all of the clients in all the various different settings that we're active in. And a 24-month payback is always achievable. Sometimes it's much quicker than that. So it's unusual to have a product like this that is kind of a net new technology with a very, very clear return on investment. And I think, the energy crisis that we've all faced over the last 18, 24 months has definitely shone more of a light on this. But even when that normalises back to standard rates, even more sensible rates than they might have been over the last 12 months, the return on investment profile doesn't change dramatically because the waste is significant.